Hi everyone! Today we launched a new tool that can help you assess if you have COVID-19. I'm joined by Susan Tu, our Consumer Experience AVP for Intermountain Healthcare, who will be talking to us about this new tool. Susan, can you give everyone a general overview about this tool and how people can use it?
Yes, I'd be happy to do that. This tool was developed and based upon CDC and WHO guidelines. So it stays very, very current with recommendations because they can change daily. But it also allowed us to step in as a healthcare system and fine-tune and make sure the algorithms were meeting the needs of the people of our state. So it allows an individual to jump onto an intermountainhealthcare.org website, maybe a hospital website, maybe our main website, maybe our COVID-19 webpage, and they'll be able to see the symptom checker and all those locations and then step into the flow and actually assess themselves and arrive with a recommendation.
That's great. It's a nice tool to use. It is available on every single page on our website, so as soon as you open up our website, either on mobile or on desktop, the bot actually shows up in the bottom right-hand corner and asks you if you have questions about COVID-19, and then you can walk through it. So why did we decide to launch this tool? What was the whole benefit behind doing this?
We really think there's tremendous benefit for both the people of the state of Utah as well as healthcare delivery systems. And the reason we think it's important is because people have lots of questions. They're uncertain about what they could be doing or should be doing. And in fact, what we see are behaviors that may actually be hurting us rather than helping us. So we thought the symptom checker was a great way to help patients understand what it is they should be doing. And it's just based upon answers to questions that they provide us. And one of the things we like about this, it keeps patients from unnecessarily exposing others if they are asymptomatic but may be carriers of the COVID virus.
Yeah, so it's a really good way to figure out if you actually need the care before you head to an actual facility. If you could choose one main benefit of this tool, what would you say it is?
I think a main benefit would be described as ensuring that we as a people are behaving in the ways that are best to ensure our safety, to ensure our health. I think it is just another item of information that allows people to make the right decisions. So I think that's the most important thing, helping people understand whether or not they actually should access health care, and if they should, the best and the safest way to do that.
And how long does the symptom tracker actually take to completely go through the entire thing before you're given recommendations on what to do?
It just takes a couple of minutes. Okay. You run through, there's a series of, 10 or 15 questions. And again, depending on the answers that you provide, you're going to be presented with the right next step for you.
And what kind of questions can people expect when they actually go into the symptom tracker? Can you give some examples?
Yeah, there's really kind of categories. So first we want to know where you've been and who you've been around. So if you've been in one of those locations where COVID-19 is really rampant, we'd like to understand that. Or have you been told, again, that you've been exposed to it? Those kinds of questions. I call those sort of location questions. Then we step into symptom questions, and there are a series of questions we need to ask based upon the kinds of symptoms that present typically with COVID-19. So we run through that. Now within those, we want to make sure that you're not experiencing something that might be life-threatening. So we absolutely cover that as well. We also want to understand how old you are, because there are definite indications for different populations. So we need to ask that question. And then we want to understand, do you have chronic conditions as well? Because again, that increases the risk if you've got other things such as diabetes or high blood pressure, those kinds of things. We want to understand that. And finally, we want to understand, are you on any sort of immunosuppressant medication? Because again, that puts you at greater risk. So once we've run through that, then we're ready to share with you what the appropriate next step would be.
That's great. And I think it really talks about the entire social distancing concept that we've been talking about for a long time. You get to actually find out if you should go to facility, if you should stay home, if you're going to be tested or not. So anything else you kind of want to talk to us about with this new tool that we've developed?
I think the thing I'm really happy with, beyond the fact that we were able to put this in the hands of the general public, is we are able to recommend to them places they need to go. So if you run through and you've got some symptoms and we think it's appropriate, we're going to ask you to make a phone call. And you're going to call the COVID call center. And that phone call, which is free to the public and it's for everyone to phone into, will help you decide what you need to do next. And you may be someone that it's appropriate to test for, and we're going to direct you to the right locations to minimize exposure to others and to keep you safe as well, but also allow us to better understand if in fact you do have that. So Again, I really like the fact that we are able to help keep the public as safe as possible, and also our healthcare system as well. Ways to alert the system if you're directed to come in, make a phone call, let them know you're coming, things like that. It really does help us on both sides of the aisle, both as potential patients, but also as well as our care delivery system.
That's awesome. So if you guys would like to check out the new symptom checker tool that is now available, you can head to intermountainhealthcare.org. That's going to appear anywhere on any page that you land on the bottom right-hand corner. It looks like a little chat bot. You can go ahead and click that and start the conversation. If you'd like to speak to someone over the phone, you can call our COVID hotline at 844-442-5224. Thanks, guys.